My name is Lily Kpobi. I'm a psychologist by training. I work at the University of Ghana and do research in mental health.
My name is Erminia Colucci. I'm a clinical community psychologist by background and a cultural psychiatrist and a visual anthropologist and a filmmaker. So we actually here in Berlin, also with Ursula, presenting Nkabom, which is actually our world premiere of Nkabom. So thank you for having us here for this very important event. So this is part of a project we've been working for over 3 years now, which is called Together for Mental Health, which is a collaboration between 4 institutions, Middlesex University, my institution, King's College London, which is Ursula Read institution, University of Ghana, Lily, and Gajah Mada University in Indonesia. And we are collaborating, looking at collaboration between faith-based healers, traditional healers, and the mental health professionals in Ghana, Indonesia, and seeing if these collaborations improve mental health care and try to eradicate human rights abuses in these 2 countries, in short.
Yes, so with the Ghana context, there's been a recent drive to improve community mental health care. So we have a lot of mental health workers who are starting to build partnerships with traditional and faith-based healers. So this film really is looking at what those collaborations look like and what helps it to thrive, or what are some of the challenges that they encounter when they go out into the field. I've been really interested in understanding what's alternative ways of providing mental health care beyond the biomedical provisions, which has been dominant, or at least in the discourse. But there's also been a sort of parallel provision of traditional healing and faith healing and other forms of therapies for mental health care, because there's such a need. There are not many mental health professionals in countries like Ghana, so many people do rely on traditional healers. So I've been really interested in understanding, what do they do, what are their methods like, how different are they from biomedicine, what can we learn from those methods that perhaps we can use to integrate the care that is provided. And in integrating or in understanding what they do, then we can also look at ways to regulate and monitor to be sure that people are not being abused and so on. But we can also learn things from them, which can be useful in psychiatry generally. So those are some of the areas that I've been busy researching lately.
Well, I'm very much kind of linked to what Lily just spoke about. My interests are very much about mental health and human rights, particularly looking at low and middle income countries. Mainly I work in Indonesia and other South Asian and Southeast Asian countries. So Ghana was my first experience actually working in this context. But human rights and child rights, women rights, and mental health issues are kind of my main area of research, as well as prevention of suicide, particularly youth suicide in low middle-income countries, as well as humanitarian settings. So these are my main kind of topics of research, but also I research methodologies and looking particularly within cultural psychiatry, cultural psychology, and critical approaches to this branch of disciplines. How can we actually use methodologies that involve more people in the community, that are made for the community? And that's how visual anthropology approaches applied to the visual psychology and the psychiatry then came about. So very much my work is around arts-based method and visual methods, and using theater and visual film and photography principally.
We are starting to see more and more interrogation of what constitutes a valid approach or a valid way of knowing what mental health is about, or how to even access care, and what healing or what recovery means for people. So for me, one of the things that is very striking is this shift, or this gradual, at least, consideration of the fact that indigenous ways of knowing or indigenous ways of healthcare can also be considered equally valid. But we've got to understand what they constitute and how it works. What are the nitty-gritties of what make up indigenous knowledge systems when it comes to mental health care. And those things will transform how we look at interventions and what it means to have recovered and things like that. So those are areas that I think are really gaining ground these days. Yeah.
Yeah, and I guess partially what also Lily said, but also looking, I think, I don't know if it's what I'm seeing or what I'm hoping, but what I definitely see also through these projects we've been involved in is a greater involvement of people with the lived experience of mental health issues. Both people who themselves have experienced these issues and the carers and the families and others in the community. And I believe this greater involvement is opening a potentially new perspective in terms of what matters to them, what recovery, for example, means, as Lily just mentioned, what actually healing means to them, because a lot of focus in psychiatry, as was mentioned before, and also psychology, more traditional psychology, is being about a biomedical approach, which obviously for people like us interested in culture, it is very scary, because it is a monopolization, more or less, of looking at one way of intervening and one way of looking at what mental health and mental illness means. And when you start involving people who actually have experiences and are able to share those experiences, then there are necessarily new perspectives that are brought in and the new voices that are being heard. And also methodologies like using visual methods, more accessible way of having people sharing directly their voices can bring this perspective within any branch of mental health, including cultural psychiatry.
I think that it is how we can start to transform what is offered, because there are some, it's been sold, psychiatry has been sold as the answer, to a lot of problems. And to a large extent, yes, it's very useful, very helpful, but in a lot of contexts, it's also not enough. That alone is no longer found enough. So looking at cultural psychiatry means that we can start to interrogate what else can we offer beyond the medicalization or beyond the structured talk therapies and so on. What else can we pull together? What cultural ideas and values can we include so that the wellness or the recoveries that we're seeing are more contextual and they're more appropriate for the people that are using it? So we need to understand these things, and we can't change things unless we research things and understand it and imagine a different world. So it's really important that we do these kinds of projects to help understand what's out there.
Mm. Yeah, I guess kind of connected to this is what it brings to us is the understanding that care, healing doesn't happen within a psychiatric ward or within a psychologist's clinical room. It's something that mental health and mental illness have their origin and therefore also their kind of healing process within the community society. So looking at culture, and when we say culture, in my perspective, we're talking about cultural, social, political, spiritual. So all the dimensions, really looking at us as what we are, an holistic being composed of many dimensions. So it's bringing that, who we actually are within the clinical practice. It's something, I don't think it's something we are bringing in, we are bringing back in. Because as also we spoke this morning, that when you look at psychology, at least I guess our field, was the origin of what actually we did, and then became something else, something that was reduced, not in parts. And now I think we're kind of going back to something that we were before as disciplines, but also bringing new perspective. Obviously, century of knowledge exploration have brought to us.
We went to one of these prayer camps, and prayer camps are faith healing centers where, the pastors may run their healing sessions, but people typically come and stay there, they're resident there, and they go through all the different rituals or processes to get their healing. And so we had been following some of the nurses to look at how they were engaging with people who were living there and so on. And somebody was brought in, a person who was having some kind of episode was brought in, and he had been chained up, and he was in distress, had been brought there. And it was really difficult for us to see that. And I mean, we couldn't film the person because he wasn't well enough. But to have to walk away from that, knowing that somebody had been brought in such a condition. And it really made me appreciate what the nurses, the health workers who go into the field go through, because sometimes you can't just go and insist. I mean, chaining is illegal, but you can't insist that it's removed because there are often no alternatives to provide the care in some of these communities. But what was really nice was that we followed up later and realized that the nurses had negotiated with the healers, with the family and so on. The person had been started on treatment and he was doing better. He had been removed from the chains and all of that. So those kinds of stories really helped to show what we were hoping to see. And to understand. And for me as a practitioner who works in a city, in an urban area, these are not things that we're confronted with because these are rural communities. And it was such a learning moment for me because I realized that going outside of the hospital setting where I would typically work, things can be very different. And as much as they were difficult, we also saw some victory in a way coming out of these stories. So that's one of the things that really stands out for me.